Throughout time, mankind's ingenuity has been breathtaking. We've discovered fire, invented the wheel, created the World Wide Web. Yet for centuries, one tiny microorganism has defied us.
I feel that tuberculosis at present is like a time bomb, and it will blast any time.
Tuberculosis is one of the world's foremost infectious killers, infecting 9 million new people every year. And now the bacterium is mutating into far deadlier forms.
You should be not just worried, but very worried about drug-resistant TB. There's an estimated over 600,000 cases in the world, and these cases are everywhere. They're in Europe, they're in Africa, they're in Asia, they're in everybody's doorstep. It's everybody's problem now.
Drug-resistant TB does not respond to the first-line antibiotics used to treat standard TB. It's airborne, infectious, and spreading indiscriminately.
We're now facing a major emergency with drug-resistant TB, with increasing numbers around the world. In all of our projects, when we look, we are finding patients in really large numbers.
One infected person can spread TB to another 15 more person in a year. So if we don't treat this multi-drug resistant TB, then there will be lots of open cases and it will keep on mounting up again more and more.
Despite the growing global health threat, the response is shockingly inadequate. Today, barely 1 in 20 TB patients is properly tested for drug resistance, and new tools in rapid diagnosis have yet to reach many places.
After receiving the reports that my daughter died on MDR, I nearly had a stroke. She was tested in time, but I was told that the results will come after 6 weeks. 6 weeks came, 2 months came, 3 months came, 4 months came. That time she was dead already. If maybe there was a way of getting the treatment sooner, she wouldn't die.
For Brigitte's daughter, the long diagnosis period cost her life, but not before the resistant strain of TB had spread to her young son. Thankfully, a new rapid diagnostic test enabled Savule to get the right treatment fast. Now he faces the next big challenge.
As a medical doctor, I find it extremely conflicting to put a patient on MDR-TB treatment. First of all, the drugs are toxic, they're minimally effective, and they can cause long, drawn-out suffering and lasting side effects.
Потому что угнетает эти лекарства. Я принимаю лекарства, вот в течение 2-3 часов, даже 5-10 минут не могу сидеть. Постоянно лежу. В сутки я час-полтора всего до нога.
After 2 years taking thousands of pills and receiving hundreds of injections, patients have a paltry 50% chance of cure. And with no formulations for children available, the situation is critical.
We're in a very terrible situation at the moment. Only about 1 in 5 patients are estimated to get treatment, so this is woefully inadequate.
Add to that the extortionate cost of the drugs and grossly inadequate international funding, and it's clear we face an impending disaster.
The Global Fund is the most important international donor for TB, providing around 90% of the funding. In the last round, actually, TB was deprioritized and received a smaller share of funding. And this undermines what we're trying to do at the field, and it sends a very bad negative message about how important TB is as a priority.
The price of not acting is really too frightening to comprehend. We need more research and development, we need more innovation, and we need better tools.
Tuberculosis is a curable disease, Yet it kills 1.5 million people every year. With new improved treatment approaches, this needn't be the case.
High-burden, drug-resistant TB countries need to show leadership by dramatically expanding diagnostic and treatment services to people suffering from this disease.
In MSF projects around the world, we see more and more people testing positive with drug-resistant TB for the first time.
У нас в семье болел моего девера сын. У него была устойчивая тоже форма, поэтому я первично и сразу устойчивая форма, потому что от устойчивого больного я заразилась устойчивой формой.
People like Asia are diagnosed using a rapid test which detects resistance to first-line TB drugs in hours. This means they get the right treatment faster, improving their chance of cure and reducing infectiousness. However, its cost and reliance on electricity can be restrictive, and a point-of-care test is still needed. Meanwhile, our teams are out in the community, tracing patients, friends and family to find new cases of TB.
После того, как узнали, что я больна, они все, естественно, сдали анализы, мои дети. Не только дети, мой муж, свекор, свекровь. Вообще я была очень удивлена. Ну, а так, в общем, все нормально, все хорошо, но они должны пить для профилактики лекарства.
Rapid diagnosis and active case finding are crucial in the fight against TB. And as the number of patients grows, MSF has learnt simple and effective treatment approaches.
I think the most important lesson that we've learned in the past years is that we need a patient-centered approach.
Once diagnosed, patients face a long and daunting treatment. However, with the right support, people are better able to adhere to their treatment. And today, adherence is the best form of prevention.
What is very special about our project is that we provide the comprehensive care package to our patient, which includes HIV/TB integrated care. So you have the doctors doing the treatment part, you have the counselors and the psychologists and looking after the mental health of the patient, and then you have the outreach team.
During the first phase of their treatment, if they live close enough, we invite them in, we make sure that we observe their treatment, we give the injection at the health facility. This may involve paying bus fares or public transport allowance.
Providing basic enablers like food and transport helps patients adhere to treatment and reduces default rates.
Lo munye uvele ugcine ade kwale mali yokufika ayokuthola i-treatment. Lo munye agcine ade ngiko labaningi makhanjwa bagcina bajike endleleni babanga ukuthi engakulukhulu vele nangibuka.
By taking care out of the hospital and into the community, MSF is able to reach and treat many more people successfully.
We try to find a way of supporting them to take their treatments at home. This will involve a community treatment supporter to visit them at their home and to address problems that they're having.
I'm helping them to motivate them to take their treatment well, and I encourage them and I tell them my story, that I've been there, I've experienced this, you will get through it and you will be okay and you'll be like me.
The difference is so palpable and you can actually see it, because patients who have good family support are the patients who manage to complete this treatment pretty successfully.
As well as support at home, psychosocial care and counselling services form an integral part of people's treatment. It helps them to face the stigma and fear associated with the disease and to work through the long and painful treatment.
Стресс в каком смысле? То, что все, я неизлечима, я уже не вылечусь, это серьезное заболевание, ребенок, наверное, у меня будет ненормальный. Были такие у меня. Но при поступлении в стационар я узнала, что у меня устойчивая форма, это меня вообще убило.
It's not easy, but it's that motivation, that encouragement, the support systems that we help them identify to work with, that helps them through it. And when they start having the faith that it is going to work, they gradually start believing it, and that starts showing in their treatment.
Чисто разговоры с ним я успокаивалась, они меня успокаивали. Разговаривая с ним, я уже понимала, да, действительно, все лечится, все излечимо.
Successful treatment is the most effective way to tackle the drug-resistant TB crisis, along with simple yet effective infection control in medical facilities and patients' homes. TB is a curable disease, and the evidence is clear.
I think the key should always be rapid diagnosis and rapid treatment, because within 15 days of initiating therapy, we know that the patient is already less infectious for his family members and also to society at large.
New treatment approaches are a step forward in tackling this crisis, but we face one final frontier. Patients and medical staff urgently need a new and improved treatment regimen. Today, we have a historic opportunity to make this happen. The drug-resistant TB crisis is mounting, yet the old and toxic drugs are failing to deliver. A new treatment regimen is urgently needed, and after half a century of neglect, the chance is finally here.
Whether the tablets make me sick or not, I must take them each.
Every time when I have to swallow this, it is just, a trip to hell, but what to do? To live, I have to do this.
दवा खाए 2 महीना 3 महीना दवा को देख के इतना गुस्सा आता है क्या इतना दवा रोज रोज खाने का.
For a chance of cure, patients must take around 15,000 pills.
Это лекарство мне влияет и на зрение, и на слух, и на память.
अभी इतना वो दवा से इतनी साइड इफेक्ट होती है कि कमर के जॉइंट दर्द, पैर में दर्द, बाल निकल जा रहा है.
Endure 8 months of punishing daily injections.
Some patients will develop depression. We've even had patients commit suicide because of the treatment.
For 2 long years.
If we follow international best practice guidelines, then we actually get 54% success rate.
We're down to levels of 1 in 2. We're flipping a coin almost, and who gets cured. And this is clearly unacceptable.
Our patients are suffering, our medical staff is distressed, and as the epidemic grows, the cost of inaction is mounting.
The cost of the drugs alone for DRTB is around $3 billion a year. Think about that, $3 billion a year. And on top of that, we have to pay for other costs. We have to pay for the long treatment period, the hospitalization, the management of the awful side effects that we see. This is something that's clearly not going to allow us to scale up treatment to a level we need to meet this public health problem.
What we need today to bust the epidemic of drug-resistant tuberculosis is a treatment that is short, less toxic, and more affordable.
After nearly half a century of neglect, the wait is finally over.
Today we have a historic opportunity. The TB drug pipeline is the best it's been in the last 50 years.
2 new drugs have been registered and others are in development. This is an important step forward, but individually, no one drug is the answer.
We need to see these drugs being put together. We need to see new regimens being developed. We need something practical coming out, not just new drugs. We need real treatments for patients.
The time is now to push on and develop an optimal treatment regimen to find the best, shortest and most effective cure for patients.
मेरी रिक्वेस्ट है कि इससे अच्छी दवाइयाँ देवे और इससे अच्छा इंजेक्शन जिसमें इंजेक्शन नहीं रहेवे और खाली दवाई रहेवे.
Я бы хотела, чтобы улучшили именно вот эти лекарственные препараты, чтобы они были лучше, чтобы у них было вот эти побочных действий меньше.
Please, let us get into something which is short and really effective with less of side effect.
A new treatment regimen is the giant leap necessary to tackle this global crisis.
We have to seize this opportunity. We can turn this epidemic around. We need to step up. We need to deliver.
The dream of having shorter TB treatment for multi-drug resistant TB, the dream of having treatment that doesn't need injectables, and the dream of having treatment that is better tolerated, has less side effects, is at a point where we can make it a reality.
What is coming out is revolutionary for TB. And I think we have a moral obligation to do better, and that we have a moral obligation to really tackle this problem because we have the ability to do so. Because we can, we must do it.